Hi, everybody. I know people are still joining, but I do have 3 minutes past the hour now on my clock. So I think we should go ahead and get going, if that's all right with everybody. I'll try and speak slower than I usually do. Maybe that'll give everyone a chance to get settled in and maybe get their cups of tea ready. But I did want to extend a thanks, particularly to those that joined even before the hour and have been waiting for a few minutes for us to get going. It's a real pleasure to have everybody here today, and of course, for me to be joined by Hannah. I'll give Hannah a chance to introduce herself in a second because I think you'll all really be interested in the context, the experience, and the learnings that she brings to our conversation today. But before I do that, I just want to do a couple of housekeeping points, if okay. Clearly, we're on a Zoom webinar. We are recording the session so that other people can benefit from listening to it afterwards if they weren't able to join us today. And so therefore, although I've made the settings such that you are free to chat with every other attendee on the session today, as well as free to chat directly to Hannah and myself as the host and panelist, please do be mindful that that is likely to not be anonymous if you're using the chat function. If you have a question and there's something that you do want to interject, or there's a point you would like to make, but you'd like to do that anonymously, please use the Q&A function that's here in Zoom. So with that being established, thanks again for joining us. It's a real pleasure to have Hannah with me and talk about this topic, which is clearly near and dear to our hearts here at Fertifa. I will use that as a chance to introduce myself really quickly. I'm Eileen Burbage. I'm the Executive Director at Fertifa. We are the most comprehensive reproductive health benefits provider across the UK and Europe. We help more than 100,000 different lives through reproductive health journeys, irrespective of where people are in wanting to reproduce, but as they relate to their reproductive health systems or their reproductive organs. And we do that by supporting fertility and family forming, all of women's reproductive, hormonal, and sexual health, men's hormonal, reproductive, and sexual health, and also now neurodiversity, well-being support as well. So with that being established, we are so proud to say that one of our preferred clients, we'd say that about most of our clients, if not all of them. So I think I can say that everyone's preferred. We count Bain Capital, and we're very, very fortunate to have them as a client. They've been with us for quite some time, so have really helped us develop much of our proposition and to improve the services, the delivery, and the patient experience, or what they would obviously characterize as their employee experience. And with that, I'm joined by Hannah Parker from Bain Capital. So Hannah, do you mind introducing yourself really quickly, please?
Of course, happy to. So thank you for having me today, Eileen. So as I say, my name is Hannah. I head up the people team at Bain Capital for mainly focused on the private equity business within Europe, and then also overseeing all of our HR operations and benefits for all of our European teams and businesses.
Amazing. Thank you so much for taking the time then to be here with us. So I thought one way to start the conversation, or at least just to give us something to maybe tie it off of, and also get a feel for what the other attendees might be bringing to the conversation today, we might start with a poll. So it's a very quick one. It's a very easy one. We're not going to go into too much detail or anything too complicated, but it's simply to ask attendees who are on the webinar today whether or not the workplace that you're at, that you represent, that you work for, do you have reproductive health support for employees there at your workplace? And I'll just give people a chance to answer it. I can tell how many have answered, and so it's ever increasing, and we can see how the answers are affecting the results. Just give it another 30 seconds maybe for it to be a minute for people to respond, and we'll see where we're going. We're getting the majority, more than 50% so far, saying that they don't. I'll show the results. Don't know if I'm the only one who can see the results, so sorry, I'm probably giving it away there. But I'll give it another 12 seconds. That'll be a minute for everyone to respond if they would like to. And then I'll end the poll and we can talk about things from there. It'd be really interesting if 100% of respondents said yes. I think that'd make this a really short webinar, Hannah, and we could talk about all sorts of different things instead. Or on the other hand, if 100% said no. But where we're at now, and it's been a minute, so I'll just close the poll and share the results. It is looking like 60% don't, more than a quarter do, which is brilliant, but almost 15% aren't sure. And I would actually argue that sometimes that's worse than saying no, definitely much worse than yes, because that means the benefit might be there or the well-being support might be there, but individuals aren't aware of it and so clearly aren't making use of it, nor is the organization deriving any benefits as one that might be taking that up. So I'll stop sharing that then, and then segue from the poll to maybe invite you, Hannah, to share with all of us, when you looked to introduce reproductive health benefits and well-being at Bain Capital, what did reproductive health mean to you or to your organization?
Sure, by all means. So I think probably what it looked like then when we initially started investigating it to what it now looks like is actually evolved, that's for sure. So I think when we initially started looking at it, it was off the back of a desire to really investigate how we could support better, specifically on fertility and family forming, and more specifically aspects like IVF support and egg freezing, which were things that we were hearing from our employees and also actually from candidates and processes that they were seeking support on. In addition, we saw a number of people experiencing menopause and needing support through that. So we specifically went to market to look for a partner for those particular areas. Now that said, I think then having met you, Eileen, and spent time really exploring, understanding more of what really sits within the universe of reproductive health, and it is very broad. What we developed was actually a much broader reproductive health policy and benefit offering. We've tried not to be too prescriptive with what's included in that. We've said we should, no one situation is the same, so you can well expect that new things will come up all the time. But to give examples of what we are using it for, it is for treatment of health issues such as menstrual health, PCOS, endometriosis, perimenopause and menopause, screening for things like prostate cancer and testicular cancer as well. It is the family forming advice and support around things like IVF and egg freezing, as well as also things like surrogacy and adoption, actually, and also things like people seeking support around miscarriage and baby loss are also coming up. So it is a full suite of things that we're really looking to offer through the service.
That's brilliant, thank you. And I can attest to the fact that that's one of the broadest sort of, coverage policies that we get a chance to work with and sort of support. So thank you very much on behalf of all of your employees and colleagues. To put that into context with other priorities that you might have had at the organization, how did that dovetail into, or did it lead maybe the initiatives around other forms of well-being? May I ask, was it sort of at the top of the list? Was it sort of after you had done maybe other types of support, whether it's for mental well-being or financial well-being or other things? How did you think about them? And was it sequentially or was it all in the main?
Yeah, I mean, I think if I take a step back, I think the initial there were probably sort of two initial parallel considerations when we were thinking about introducing this benefit offering. I think one was indeed just a desire to have a more holistic wellness offering and well-being offering. I think, like most organizations, I think we had a very competitive and comprehensive offering when it comes to things like private medical insurance and access to EAPs and that sort of thing. But our environment, I would say, is one where it's very fast-paced. There's a lot of people who work very hard and are very ambitious and have very busy careers. And we were looking to really try and see what else should we be offering that just actually makes life and the mental load of life just easier for people as they go through challenges at different stages. And I think reproductive health is something that obviously a lot of people encounter. And so there was one area that came up from that angle. And then I think the other angle is, of course, the diversity, equity, inclusion and belonging lens. We were doing a lot of work in looking at, particularly at the time, gender diversity, and we'd brought in a lot of women into the business. And through that process, and I mentioned earlier, we had more and more people saying, well, what do you do in terms of fertility support, and do you offer egg freezing? And that started coming up more and more in processes when we were hiring candidates. And so those two together really led us to to then think, okay, I think this is something that if we step back and look at our wellbeing offering and our wellness offering, this is something we'd really like to prioritize and do.
That's brilliant. And you mentioned a couple of times that, candidates, so it wasn't just existing employees, but you were seeing this coming up in candidate conversations as well. Was your experience that those candidates benefited from these types of coverage or wellbeing support at previous roles, or had just become part of their list of things that they were looking at and considering?
I think more that it was becoming something that they were looking at and considering. And I think that obviously the dialogue on these areas has just become more significant and more transparent and open in recent times. And so I think therefore it's not therefore surprising that in interview conversations people are going to explore some of these things more, and it also gives them a flavor of the organizational culture. That's why they're going to ask the questions, right? How much do you really sort of go the extra mile to care for your employees and really support them?
Yeah, absolutely. And as we know, with any kind of a conversation in an interview situation, sometimes they're just looking for your reaction, right? And how surprised or shocked or, agreeable you might be to even having that question posed. And so in terms of then, once you recognize this as something that you wanted to do to round out your wellbeing support offering more broadly, I guess because you'd already, like you said, really had a comprehensive package already, or it was already quite competitive, was the process then relatively straightforward? We often get asked by advocates, or I call them, champions. We'll get approached by someone who's really an internal champion in an organization, but a little bit flummoxed as to how to get things started, how to get the buy-in, how to get sort of approval, or to establish that kind of internal stakeholder, encouragement. Do you have any advice or any learnings from that process, or how you did it?
Yeah, I mean, I think it's a relatively straightforward process, but it took time, right? Because I think you do, as you say, you ultimately need to build your business case for why actually this is a good investment. And what we did was we introduced the concept of the lifetime allowance, which is not an insignificant financial commitment for the business to make. And so, yes, we needed to sort of do the groundwork to be able to demonstrate that this was a good investment. And to really do that, so I think there were sort of two really primary things we did at the outset. So one was, gathered the information from within the business, and I mentioned the candidate data to demonstrate that actually this was an area, broader reproductive health was an area where there was value in investing, and we did that through so one of our HR business partners picked up the project and did a number of interviews across the business with individuals, and particularly speaking to individuals who we knew had perhaps previously spoken to us about going through fertility issues or concerns and that sort of thing, or had previously asked us about things like egg freezing, or had raised menopause, as well as a broader demographic as well, and asked them about what they were really sort of seeking, what would have been helpful for them. So we got those sort of interview inputs. We also were quite fortunate to have a healthcare and life sciences team within our business. So we actually spent some time talking to them as well around what they were seeing in terms of offerings in the market from the research that they'd been doing themselves. So that was quite a helpful input. And then we do an annual engagement survey, and we had seen information within the annual engagement survey, commentary within the annual engagement survey come up about actually the value of having particularly things around sort of the family forming, as I mentioned before, as a benefit offering. So with that data set, that was helpful at sort of the diagnostic stage. And then there was the external piece. So let's go and actually benchmark and understand what we're seeing in the market. I think I'm sure you'll attest to this, but we've started to see an increase in firms adopting family forming benefits in particular, or at least developing policies around it. And so we did get some data on that, particularly from within the peer space, within private equity. And it's clear to us that whilst still not a broad benefit that everybody offers, a number of organizations, and certainly those we consider our competitors, were starting to look at this very seriously. So so that was another important data point for us to have. So I think doing that initial groundwork to then say, okay, here is the case for the why, this is what the information is telling us. And then of course doing the obvious like cost analysis of, well, how many people do we think are going to access their lifetime allowance per year? So we can just get a view on what we think that's actually going to cost us as a business. So we did some work on that as well. But I think once we'd done that and framed this in the context of this as part of our broader focus on wellness and well-being and providing that more holistic support to our business, we had very strong support and buy-in from our leadership to move ahead.
That's brilliant. Thank you for being so comprehensive and open about all of the different points and topics that you considered in building that case and putting in that time to do that work. One thing that I wanted to ask, because we get asked it quite a bit, and I know that it's relevant to you as well. You obviously have people in different countries across the organization. So was it, did you think, and I know the answer, but I think it'd be helpful for the conversation. Did you consider, let's roll it out in one country first and then see how that goes? Was it important to try and harmonize it across multiple countries in order to launch it in the first place? How did you go about thinking about that?
So we were, so Bain Capital in Europe we have our largest operations in the UK, but we are quite geographically dispersed. We have smaller teams across several more countries within Europe. And I think we really wanted to be fully inclusive. And I think some of the challenge we've had before is because of size of some of those number of people in some of those locations, it's been hard for us to actually implement benefits for them at the same sort of level and the same sort of comprehensive offerings as we have within the UK where we have scale. But we really wanted to see if we could do it. Now, thankfully, we came to you and you were able to cover Europe, which I think was a very compelling factor for us in then moving ahead and working with you. And I think, we also have a very, I'd say a very European workforce that are in the UK as well. And we had people saying to us, I'd like to freeze my eggs, but I want to go to Spain to do it. So is that possible? And it is possible and was possible in partnership with Ativa. So that was definitely a big driver for us to then go ahead with the partnership.
Super, that's brilliant. And in already this first few minutes of the conversation, you've touched on so many different things that are involved in reproductive health. You talked about maybe the first conversations or the first requests or queries that came from candidates or employees were around, that family forming piece. So IVF, maybe some egg freezing, but you also talked about how menopause questions came up, talked about how you provide screening, for testicular cancer, prostate cancer, and such through our men's reproductive health pathway. Just in terms of maybe framing for everybody else who's listening in, I do want to also just be more specific about what we're talking about when we talk about reproductive health. And so, you had kindly mentioned prostate cancer. We know now here in the UK, 1 in 7 men will be diagnosed with prostate cancer at some point in their lives. Unfortunately, we know that for women, whether they want to have children or not, 1 in 10 of them will likely be diagnosed with endometriosis at some point. Unfortunately, that's still taking an average of 7 years to diagnose. We know that if people do want to become parents, that 1 in 6 heterosexual couples will have a fertility or infertility challenge. And that for a heterosexual couple, that's probably 40% of the time down to the male factor. And then, of course, you spoke about diversity, equity, inclusion, and belonging. 100% of LGBT individuals who want to become parents will need some form of support. And so this is all before we talk about things that might happen even for people who are older in the workforce. So with menopause, and I've just made a mistake there by talking about it for older women, but actually we know that menopause, given that perimenopausal symptoms can start 7 to 12 years before a woman's last period, or might be the consequence of some medical intervention, for example, endometriosis or PCOS. We do have women in their 30s who are suffering from perimenopausal symptoms. And then we know that about 13 million women in the UK are suffering from menopause today already. So we do have so many topics and so many journeys really that are involved in reproductive health. Unfortunately, from our point of view at Fertifa, and the reason why we're so committed to doing what we do is we do see a gap that is sadly ever increasing based on what's available from NHS support and also obviously public healthcare in other countries outside the UK, and the cost of undertaking that independently with private care. And so we are here to sort of fill that gap, and we're really pleased, obviously, to work with clients like yourselves and companies like Bain Capital to make sure your employees and employees partners are looked after fundamentally so they can bring their best selves to work, right? And so that they can maximize, their well-being, but also their fulfillment and their enjoyment of contributing to Bain Capital. And so in that vein, I wanted to come back and ask you, and thank you for letting me grill you, for maybe only a half hour more, but have you seen, therefore, benefits with a little b, not the benefits as in rolling out the benefit, but have you seen then better outcomes for employees? Are you getting good feedback? What do you hear back from candidates? Are they actually used to hearing that you have it now, so it doesn't actually help in that process? Just what are some of the things that you've observed after rolling out the offering?
Yeah, so I think there's a couple of things really to touch on with this. I think the first is if you just look at the statistics, so how many people are actually accessing the service, whether that be through I'm going to the app, or I'm having a conversation, or indeed I'm going through treatment. And actually we're at around 15% of our employee base, which I think is not an insignificant number when you consider our size across Europe. I think it's a very meaningful number. And I think what we have seen is they are, to your point, this is much broader offering, and that we know that they are making use of this for all sorts of different reproductive health circumstances. Now, the feedback we've had, which has both been anecdotally through conversation and then also through, again, our annual employee engagement survey, we've seen some positive feedback, is that it is doing what we need it to do, which is it's providing individuals with that. Indeed, it's like in many cases it's the backup avenue if the private medical insurance or the National Health Service are not able to deliver what they need, and often they can't, then this is a highly valuable service. Or if they just need some help navigating these situations. I think it's oftentimes we hear, I just didn't know where to start, right? And so when they can just go onto the app or pick up the phone and have a conversation, and initial consultation to understand actually this is how you would navigate this situation and just get some information is very valuable for people. And I think, both it gives them that sense of achieved what we wanted to achieve in terms of it's relieving some of that mental load and stress which comes with many of these things. It's obviously helping their well-being in that sense, and in a physical sense as well. But I also think that it is helping our organization from a culture perspective, right? Because people do feel more engaged, they feel cared for, they feel like they belong when their employees are giving them access to this sort of thing. So all in all, yes, I think we are seeing the benefit with a small b.
That's great to hear. And you had also mentioned that even prior to rolling out the benefit of the capital B, you'd had the conversations, you'd have people asking you questions again about egg freezing, say, or menopause. Do you think since rolling out the benefit, you have even more conversations about that, or it's has it normalized these topics a bit, which, to your point about culture, is it palpable, or, do you sense that has helped to shift the culture a bit?
I absolutely do. I think I would say yes. I've had more people come into my office and say, I've got this going on and I'm using the benefit, and I want you to be aware. But I'm okay. I don't need your help. I'm fine. I've got this sorted. But you should be aware I'm doing this, and thank you. You get more of that. And I think I've also had managers come to me and say that they have had more open conversations with team members who are going through something which may be related to one of these areas or issues. So I think we're definitely seeing more open conversation, which I think is a good thing. And I think it's also from I mentioned this sort of engagement point, I think it does create just a little bit more of a sense of, and you do see it in our actual engagement scores for some, and those who have sort of really benefited from it. It does move the needle for them in terms of that sense of care, and I belong, and I feel like this is an organization I want to be at, and I know cares for me, right? So
Yeah, that's amazing. And of the topics, of the things that people have said, and I love that they're saying thank you to you and they feel more open, or they're saying that to their managers. Have there been any surprises? Were you surprised at the number of conversations about menopause, or were you surprised maybe about the conversation from, I don't know, single individuals, men? Was there anything that came up that you weren't expecting necessarily?
but I think it comes back to the point at the beginning I mentioned. I think, when I initially thought about introducing this, it was more with the family forming elements in mind. And I think what we have definitely seen is just actually, the number of things that do relate to things like menstrual health, and indeed sort of men's fertility challenges and that sort of thing. Just, I think I very rarely was having conversations about those things in the past. We now are, and we know that there are some people who have, clearly, I'm sure people were going through these challenges previously, but they weren't able to access something in the business to support them before, so we weren't having the conversations, right? So that's probably the biggest surprise.
I love it. I mean, I think there's still so much more, that we have yet to learn about what really impacts people's well-being. And we've found, as you've seen, having the umbrella support just does help people to feel that there's peace of mind and the safety, frankly, to have a conversation, whether it's I don't need your help, I'm all good, just a heads up, or to say I'm not sure where to start, or this has been amazing, or we still aren't really helping me with this. And I just think that's sometimes the key to it all, isn't it? Like I said, I'm really grateful that you've been patient with me peppering you with questions. I'm pleased to say though that some of the other participants on the webinar also have questions as well. So I might just intersperse that with me and sort of slightly interrupt the flow. And I'm going to come back to my list because I've still got more for you. But somebody's asking, given everything that you've done, and you did talk about policies that you had in place and so on. They're asking whether you would suggest a dedicated reproductive health policy, or if you feel it's best to split them up so that there's a menopause policy, a fertility and a family forming policy, or other separate policies.
It's a good question, and I think it's one that we debated quite a bit when we were going through the implementation process with you, and we actually landed on the side of actually let's have one holistic policy, and leave it a little bit more case by case, and say come and have conversations right about each of these individual areas, and I think that the reason for that was more because there are just so many different areas I think that you can cover, and I think and actually no one situation, even if you take something like menopause or indeed IVF, then no one situation is always the same. And so you need a little bit of, I think, discretion and flexibility with how you approach things. So we went with more of a general policy and said, if you are comfortable coming and having conversations around your needs relating to any of these issues that you may be experiencing or any treatment you may be going through, please do so, and we can talk to you about what we might be able to do for you. And we did just say, for example, with things like appointments and any sickness, absence or health leave that may be needed related to these circumstances, we just said our normal policies would apply, but come and talk to us if your circumstance is different, and we'll just generally flex accordingly. So we left it quite organic. I think it's working. We've not run into issues with it. I think we have to be careful about, setting precedents though, and make sure we're sort of remembering if we've set a precedent. I think that's the one thing to do. But generally, I think we've sort of found this approach seems to be working, at least for our business and our business model.
Yeah, I like that, and I think that's such a great sort of real world experience of what you've seen in sort of response to how you've done it. We certainly felt if an organization is sort of trying to wrestle with this question, start with the general policy, right? Just as you said, because it's an invitation, if anything else, to have the conversation or to say that the organization is open to considering anything that could be considered reproductive health. So here's a general reproductive health policy. And then I think to the extent that, an organization is ready to think about specific pathways, great to put sort of frameworks in place. But there is this reference back to the overall sort of thesis, which is we're here to look after your well-being. I think we buy into that so much that, for International Women's Day this year, actually, as an organization, we published or sort of open sourced or made available for free, what we considered a best-in-class template for women's reproductive health, for example, as a policy. And, hopefully we'll be putting out more and more of those to try and get more organizations to put those in place, even before they might pick up a benefit, the capital B, or to offer some kind of a lifetime allowance, for example, because it's worth having that policy in place anyway, isn't it? One thing I wanted to sort of get back to then, and thank you to whomever asked that question, and please, if others have questions, feel free to put them in the Q&A as well, is whether, having now sort of established where you're at, and it sounds like you're content or satisfied and pleased with what's happened offering this benefit, what advice you might have either to yourself or to your team, who was first looking at this a couple of years ago, or to anyone else who's maybe at that part of the sort of process, which is, they're thinking about reproductive health support and whether or not you've got advice or tips.
Sure. Yes, I think there's probably a few things I would say. So, and they're all things I've vaguely touched on. I think one is definitely just take time to think through the why you're doing it and how it fits in your overall well-being strategy. Understand the demographic of your business, and then you can sort of tailor it accordingly, right? I think those things are really, really important to just do up front and do that sort of diagnostic piece that I mentioned at the beginning. I think there's also just remembering that implementing something like this also comes with a host of questions, really things like we just said, the policy thing, but it does, it will open up. So, okay, if you're gonna give me access to go and do this, will I get time off for appointments? Will I get personal leave to go and navigate this? And whilst we've not set a policy, we've had the conversation to say, so what would we do in these scenarios? How do we navigate it? What do we think is typical? And I think it's important to just do that a little bit up front and have a bit of as you say, it's having the framework, having a frame of reference for how you might want to address those questions as and when they come up, because they will inevitably come up. And then I think my other thing is, I think I wouldn't necessarily put too tight parameters around what people can access via it. I think that's been my learning as well, to make sure you really maximize the value of the benefit to people. I think we've had things come up along the way that I hadn't necessarily anticipated the benefit might be useful and leverage for, and you go, oh, well, that makes sense that we would do it via Fativa, and yes, I think we want to support that, right? So I think when you're designing the actual policy, sort of specifying that is probably a good thing, and that, okay, here's some examples of what would be covered under this, but there may be other things and other circumstances, and you should come and have the confidential conversation with us to clarify whether that's something we will support. And then I think the final one is just on the confidentiality piece. I think it's really important to think through the positioning. Obviously, a lot of what this touches on is highly sensitive and confidential for individuals. And so in the design of the process, making sure that your process is really watertight, which we did in partnership with you, Eileen, in terms of the information that HR sees, payroll sees, right? We've made sure that actually there's no detail shared, but also making sure that that's explained really clearly within the policies that you develop to your employees, so there's no sort of concern from them on that point. Otherwise, I think, again, it sort of can prevent people from feeling comfortable coming using it if they think you might get access to knowing that that's something they're availing themselves of. So.
Yeah, no, I'm so glad that you flagged that. I probably should have said that from the beginning when we were talking about the benefit and how important that is for patients or, employees to feel not only safe to have the conversations, but protected and safe if they didn't want to have that conversation still at work, but still to be supported by a workplace benefit. So thanks for mentioning that. I think that's a good reminder to me, maybe just to mention now for everyone else who's listening in. When we talk about the benefits and what's covered, and I think we've spent a good amount of time talking about all the different journeys and all the different pathways that can be covered and all the different topics that are relevant to employees, we can also talk about what shape or form the benefit itself takes. And so you have, Hannah, alluded to, how comprehensive your offering is, which was not only was there the well-being support and the advice, not only is there the educational materials and the awareness and the app, which you've already alluded to, but there's also an allowance that you've made available. And you said it was sort of a lifetime allowance that you've made available to help with employees, the financial burden of some of these treatment costs. So while that is pretty much, that's the full gamut of what we certainly can provide, naturally we do work with a lot of workplace clients who don't do every single piece of it. So, for people who might be listening on the call or considering what might be best suited for their organization, there are some who might just take the fertility and family forming piece, or who might actually just take the men's reproductive hormonal and sexual health piece, or might just take, the menopause piece, for example, as a pathway. And then within that, they might take the education and awareness, and they might take the well-being support, but then they might not be in a position yet to fund from their balance sheet a lifetime or even an annual allowance towards treatment costs. And you'll know, Hannah, because we talked about this quite a bit when we were talking about yours, we have clients and we've seen companies who do everything from a couple £100 a year per employee to, tens of thousands lifetime allowance to everything in between. So 5,000, 10,000 pounds or euros, perhaps, some on an annual basis, some on a lifetime basis. We've also seen a cost share model. So we have organizations that are really happy to pay up to an allowance, assuming that's for 50% of the costs that are incurred. And so really it can take any way, shape, or form. And that's what, we're really proud to be able to do and offer flexibly at Fertifa, because we're not sort of mandating that. And one of the other points you made, Hannah, was sort of flexibility and probably, reducing restrictions to be as flexible as possible. And certainly we think that as well in terms of how our workplace partners will want to work for their employees. So I think it's just important to talk about the full suite, but also the optionality that's available therefore in the benefit. I'm mindful of the time, and I typically like to have these run until about a quarter till the next hour, because I know everybody needs to at least run for either a comfort break or another cup of tea before their next calls. And I really do appreciate how patient you've been and all the time you've lent, Hannah. But if it's okay, maybe just one or two more questions, if that's all right. And I'm just curious, again, from where you sit, and sorry if this is a bit of a surprise putting you on the spot, where do you think, reproductive health benefits will go from here? And, you've already mentioned for some candidates, when they ask the question, it's already sort of, I don't know, an assumed thing or given, it's what they're expecting. Do you think that this will be just, the norm? Do you think, therefore, there are other areas of well-being that you'll look to support, or do you think that it's just going to eventually fall into private medical cover? What do you think it goes in terms of, for organizational support?
And I think generally, I think I suspect it will become the norm. And if I look at we implemented this with you now 2 years ago. If I look now across peers that I regularly speak with, I think a number of them now have started to adopt or are adopting. If I look at Bain Capital globally, we now in every region, including Asia, just in the last couple of months have launched very similar benefits. So I think it's going to become more of the norm offering. As to, I guess I question whether we would move to a place where it just becomes something that fits within a PMI. And I think that is because, PMI ultimately tends to cover things where there are clear medical reasons, whereas a lot of what is covered via the Fertifa support offering is ultimately elective or it's exploratory, and therefore it would be very unusual for a PMI scheme to be in a position to cover that sort of thing. And so I see the two as complementary, and I don't see a world in which structurally that can go away, right? I think you probably need both. Now, what has been great to see is if I look at like our PMI as an example, I think it has evolved. And so actually there's more things like support for menopause and fertility than I think there was in the 5 years I've been at Bain Capital and from when I first joined. But as I say, that's for typically medical reasons, and there's always limits, right? In terms of, you know, how many rounds of IVF can I have, how much treatment can I really receive, which is understandable in the concept of an insurance scheme. So I think it's complementary. I can't see it disappearing. I can see it definitely sort of just continuing to grow as something that businesses adopt.
Thanks for that. Sorry again if I put you on the spot, sort of asking you to look into your crystal ball. But I think you made a couple of really key points, because I alluded to earlier why at Fertifa we have the mission that we have, which is to fill this gap between private medical cover and, you know, public healthcare, whether it's NHS or otherwise. And you're absolutely right. I mean, I actually think it's a shame and not quite sort of the best way to look at things to consider reproductive health, you know, journeys or challenges or issues as elective, exploratory, or what's often been used in insurance speak is, you know, lifestyle choices. Because I think that many people who've been through these journeys would say this was not my lifestyle choice to, you know, find myself, you know, unable to or without the options I thought I would have. And so we're seeing how much the support helps in those cases. But you're right. The sort of the business model of an insurance sort of scheme means there has to be restrictions, right? There has to be guardrails. There has to be a process by which a claim is made. It's either determined to be a medical condition or otherwise. And I think, to your point, that's why we certainly believe, yeah, that there's sort of this other type of offering that'll become ever more sort of needed, necessary, and commonplace, but which, you know, won't be, unfortunately, delivered by PMI and probably isn't going to be coming anytime soon from the NHS or otherwise. So I think it's probably important to sort of establish that point, and hopefully we get to a point though where there are other types of models as well, because I don't think we've necessarily got it completely right at Fertifa, and I'm hoping that, and we already know there are other vendors and other providers that'll try and provide the same type of support. So I'm hoping there's a whole new category that'll make it easier and easier for folks. So thank you very much for all of that. Just before I let you go, I do want to recap it because I think you've said so many key things, and my recap would be, and I want you to add to this if I've missed anything. First of all, I want to start with the point that, you know, you shared, and I'm grateful that you were transparent about this, that you're seeing up to 15% of your you know, employee base engaged with the service. I do think that'll probably surprise a lot of people, because it doesn't surprise us, and we see that across our clients more broadly, but that does go to show how many of these topics are relevant to how many people. I really appreciated that your point was, you know, don't just look into this to tick off a box or just to kind of go through it for the sake of it. Really consider it with your overall well-being initiatives in an organization. Think about the why you'd said, and I really like that phrase, and make sure it's being tailored to the organization, to your culture. Get that framework in place, whether it's through policy or otherwise, but really don't be too restrictive, because we don't know what we don't know, and we only know what individuals and employees are willing to talk to us about now, but who knows what else they talk about or comes up when they feel that there's that safety to have that conversation and the culture is supportive. And then finally, really keep, you know, make sure that employees understand that it is safe and that the information that they might share, if it's very personal to them, will be confidential. And so therefore, working with a well-being support provider, whether it's Fertifa or somebody else in the market, really helps to complement what you as an HR leader and certainly the organization would want to deliver. So I think those were the pieces that I picked up. I've done you a disservice by recapping that in 30 seconds, but it's been really, really illuminating to have this conversation with you. I've obviously enjoyed working with you and your team for the last 2+ years, but just to kind of recap, you know, sort of where we are, how far we've come, and what the benefit means to the organization has been really, really gratifying for me. So appreciate you spending the time. Really, really appreciate all the participants that joined on the webinar as well. And I'll just mention, a special thank you in the chat again to yourself, and also a pointer if anyone wants to find out more information. But I'm grateful again that you gave us so much time, given how much you cover within the organization, and to partnering with us. So with that, I just wanted to thank you again and hope you have a good rest of your afternoon, Hannah.
Thank you very much. Thank you for having me.
No, it's great to have you. I enjoyed this conversation a lot. It was nice to finally have a conversation and not just sort of go through maybe implementation points. So it's been really, really refreshing. I appreciate it. Thanks so much. Talk to you soon.
Thanks.
Bye-bye.
Bye.
Bye all.